We're at the Japanese Gardens in Washington Park. The Portland Japanese Garden offers events and workshops. They also offer cultural holiday celebrations. It hosts more than 200,000 visitors a year. So glad you're with us on Comcast Newsmakers. I'm Ken Ackerman. Well, as part of the debt limit increase negotiations, there's a very real possibility that Oregonians will receive fewer federal Medicaid and Medicare subsidies than folks in other states. Why is that? Please welcome Oregon State Representative Mitch Greenlick. Thanks for being with us.
Happy to be here, Ken.
Please sort out what I just gave a little too much of an intro there for.
Well, these debt increase negotiations are going on as we speak right now, and there are all sorts of threats in terms of what's going to be cut to subsidies to the states. Oregon's always been very efficient in terms of producing Medicare services for decades, and consequently we're already disadvantaged because we get much less per person for Medicare than, say, California or New York or Florida or other states. So we've been working very hard in the legislature to get ready for that probability.
With our governor being a doctor himself, does that help?
Oh yes, it helps a great deal. Dr. Kitzhaber has been very active in the negotiations in the last session as a part of governor's staff, far more active than prior governors in the healthcare area because he cares a lot about it.
Let's take a look at what has put us ahead of the curve as far as the rest of the country. In 2009, a couple of significant pieces of legislature were passed.
That's right. We passed House Bill 2009 and House Bill 2116. House Bill 2009 created the Oregon Health Authority. It focused all our health decision-making in a single agency. House Bill 2116 provided the funds to increase insurance, to provide insurance for 80,000 kids in Oregon, to get us almost to 95% of all our kids being covered by health insurance. In this last session, we also passed two significant bills. Senate Bill 99, which created the Oregon Health Insurance Exchange, and House Bill 3650, which started transforming our healthcare system, particularly around delivery of services in the Oregon Health Plan.
In your mind, which direction do we need to go to even make Oregon a better place for healthcare?
Well, you know, we've been working pretty actively for more than 20 years since Dr. Kitzhaber was the Senate president to try and move toward universal access to healthcare in Oregon and to make our healthcare system more effective and more efficient. We've come a long way, but we have a long way to go. We're trying to figure out the Oregon way to do it and yet to fit neatly into whatever is going to happen or doesn't happen in the federal scene.
So how do you do that? I mean, you're already planning for the future, which is still, if I can use the same phrase, ahead of the curve. But how do you make those two jibe?
Well, a perfect example is in the health insurance exchange. Under the federal health reform, there is going to be a health insurance exchange in every state. If they're not done by a state, then the people in that state will be in the national health insurance exchange. We decided in Oregon, I think wisely, with a very small number of other states, that we can do it better if we do it our own way. So rather than waiting for the federal exchange, we created an exchange the Oregon way that had just great support on both sides of the House and the Senate. We'll do it the right way, and it will fit even if there is not a federal exchange.
Is affordability still a concern as far as the Oregon Health Plan?
Oh, it's a huge concern, not only in terms of the health plan, but in terms of health insurance for individuals and for small groups. We were about $600 million short of funding for the health plan as we started the budget. We were able to fill a hole of about $350 million, but this transformation is the model we're going to be using to try and save the other $250 million that's short right now of the expected budget. And as times get tougher, more people end up in the health plan.
All right. Thank you very much for being with us, Mitch Greenlick, Oregon State Representative. We appreciate your perspective, and we also thank you for being here as well on Comcast Newsmakers from the Japanese Gardens. I'm Ken Ackerman. Make it a great day.